Hi, I'm Eric Wilson, physical therapist.
Nick Patel, nice to meet you. I'm the Senator's legislative aide. How can I help you today?
Well, I'm here as a constituent of the district and a representative of the Texas Physical Therapy Association. I'm here to talk to you about an important issue to us and what we feel is important issues to the citizens of Texas, and that's patient choice.
Okay.
I've provided you some information here on this little one-pager, but I'd like to talk about a few key points.
Sure.
Currently in Texas, patients are restricted on their ability to access physical therapists directly for a musculoskeletal problem. What we would propose is that we relax the requirements for a referral so a patient has the right to choose who they would like to be their healthcare provider.
Who can refer right now in Texas?
Well, currently, a doctor, a chiropractor, a podiatrist, a dentist, an advanced nurse practitioner, and a physician assistant are all legal referral sources in Texas.
Really? Okay.
Yeah, so doctors aren't the only people that can refer to us. There are some non-physicians that are also able to refer to physical therapy.
Okay.
Now also, if a person had an injury, they have the ability to go to other places. They can go see some alternative healthcare methods. They might go see a personal trainer. They can go have a massage for a back problem. And all of those don't require referral. And we feel that as physical therapists, we have an advanced knowledge of evaluation and treatment skills to help patients, but yet a patient can't come see us, and we feel like we're the most skilled at what we do for rehabilitation. But yet,
so you do not need to actually see a physician to see an athletic trainer.
Correct. Yeah.
I guess that's true. I don't think I've ever really had to see one when I go. Okay.
Yeah, and same thing with massage. I mean, if your back was hurting you from working in the yard, you could call them, get a massage, and work on your back, but you couldn't come see me.
Okay, that's interesting.
Yeah.
Okay.
So we would like to be able to change this rule and relax it. So we're going to be putting forth legislation during this next legislative session to relax that requirement. Now currently, there are a few people that oppose it. Obviously, physicians are going to oppose it.
Yeah.
We've met with them in the past. We've tried to do this 3 times before.
What's happened?
Well, it always gets stalled out in committee. Some of the reasons are they feel like it's a scope of practice issue. They don't want to change things at this time because they weren't addressing scope of practice. So they would say wait till sunset. There might be various other reasons, but there's some strong opposition obviously from the medical community, and they do a very good job of stalling the bill. And they go in and we talk to the legislators and they come behind us and talk, and so it really gets stalled because it's 2 organizations kind of fighting against each other, and I know that sometimes the legislators don't want to get in the middle of that stuff.
Yeah, that's true. It gets pretty sticky. Who's on your side?
Well, we have tried to sit down with them also. Currently on our side, we are working on that. We are currently talking to other healthcare organizations and community organizations and consumer organizations to be on our side and support this. On a national level, there are some organizations that support us, direct access for Medicare at the federal level. We're also working with those people on the state level. There's also been some select organizations within the legislature, some groups within the legislature that also have already come forward and supported direct access. And we can provide that information for you in a packet that shows groups that have already supported us.
Great. You know what? Send that by because I think we're going to need to look at that. What have you tried before in the past?
Well, we've tried before. We've tried the same bill.
Currently, who's carried the bill?
Senator Corona and Representative Fairby have carried it in this previous legislative session.
Okay.
They worked real hard. They've sat down with the Texas Medical Association and the Texas Orthopedic Association with us and tried to negotiate something. And the TMA and the TOA they kind of stalled, and it kind of got last minute when we started to come up with an agreement, but it was kind of too late at that point in time during the legislative session.
So they just waited you out, huh?
They just waited us out. Yeah, nothing we could do about that.
That does happen sometimes. Well, tell me about this. You said on a national level this has been an issue as well. How does Texas stack up with other states?
Well, there are definitely some states out there that allow more access than we do here in Texas. We do have some limited scope of direct access. If a patient was to have the same problem within the same calendar year, then the patient could come back for physical therapy, and there are certain requirements that I must notify their previous physician and so forth, but I could evaluate them and initiate treatment. But if this was a first-time injury, you wouldn't be able to come see me. So there are some states that have more access than Texas, but there are some states that don't have any. But there's a number in the around 44, 46 range that have some kind of scope of practice that allows some direct access.
Can you send me that list as well?
We can definitely provide you with that list.
Okay. Anything else you need?
No, I would just like to be able to follow up with you as we go along, keeping in touch, letting you know where things stand. Once we started getting a bill filed, once we actually get our key contacts going forward, and we get the senator and representative that will be carrying the bill, I'd like to keep you apprised of those so that maybe you can talk with them about more information and possibly sponsor the bill. I would like to be your key contact. I would like to be the person that you contact if anything comes up regarding physical therapy.
So you actually haven't found someone to carry the bill this session?
We've been working on that, but it's still a little early in the season to be able to do that. But we feel like we'll have that very soon, and we can provide that information as soon as possible.
Okay, let us know when you actually do find that.